So in the realm of solutions, why not? Why people are pushing? You mentioned, and the left is pushing for national health care insurance, but you say we've already tried that here. We've got three systems we've tried that in.
Right. We have Medicare, we have the Veterans Administration, and we have the Indian Health Service. And all three of them are shambles. I mean, none of them, as a private insurance company, would survive a week. They're just very, very badly and inefficiently run. And, why should we turn over all of medical care to the government when the government has been unable to run three separate medical care systems? It just doesn't make any sense.
So instead, we go back to my favorite solution, the free market, and that involves price transparency.
Absolutely. Prices have to be, your local gas station has to post the price. Why shouldn't the local hospital post the price? And the real price, not the nominal price.
So then if they have that, then they're going to force to compete on price. Now, people will say, gee, if you force them to compete on price, they're going to cut the quality of their health care, and they're going to try to complete surgeries quicker or with less care. How do you respond to that?
Well, right now there is so much inefficiency in hospitals because there's no incentive to become efficient, that there's all kinds of low-hanging fruit. And that hospitals could use to cut their costs. And I just don't think, one thing, if they did that, then they'd be subject to being sued for malpractice if they cut corners that, diminish success rate, things like that.
Well, sued, or else the solution that you and I came up with a little bit ago, which is that I think if you had price transparency coupled with a robust ranking system or rating system, a community rating system, driven by both patients and by doctors and people in the field, so that if a hospital or a doctor got a reputation for low prices but also low quality, that word would get around. And
indeed,
so
it would very quickly.
You wouldn't be looking just at price; you'd be looking at how likely it was you'd actually get your knee fixed.
Yes, exactly, and that's transparency is always a good idea. I think it was Louis Brandeis, of Justice Brandeis, who said that sunshine is the best disinfectant.
He did, and he was right.
He was right.
So we're going to go, okay, so that's one solution. And then we got the American rule. We've got patient shopping, and you would also reform the federal programs, what they would pay. So the Medicare would not be generously paying every single hangnail that we have, but it would be more selective about what it would pay for.
Exactly. What a medical savings account is, what some companies have done this, and there's no reason Medicare couldn't do exactly the same thing, which is that they provide a certain sum of money to handle routine care, scraped knees and the sniffles and what have you. And then, in fact, major medical to cover the heart attacks and knee replacements and what have you. And then if you don't spend that money, you don't have any sniffles that year, that money would go over into your retirement account. This would give everybody the incentive to ask the magic question: how much is this going to cost?